If you can't take 3 steps in the morning without your knees complaining, this simple blend of olive oil and fresh ginger could change your week. Not years from now, just 7 days. I'm a rehab clinician who's seen hundreds of seniors walk easier with the right natural tools. No prescriptions, no gimmicks. In this video, I'll show you exactly how to mix and apply this blend, why it works, and how to track real results. Let's get started. Your knees are listening. First, why does a knee that once powered you up stadium stairs now sting during a stroll to the mailbox? Aging cartilage thins, synovial fluid loses viscosity, and microscopic inflammation smolders inside the joint capsule. That inflammation is driven by enzymes called cyclooxygenases, COX for short, and by a swarm of pro-inflammatory cytokines. Laboratory studies show that extra virgin olive oil is rich in oleocanthal, a compound that targets the same COX enzymes as many over-the-counter pain tablets. Fresh ginger root brings in gingerols and shogaols, molecules that calm cytokines and improve circulation. When these compounds mingle in a warm oil base, they slip through superficial tissues, sink toward the joint line, and nudge the inflammatory process downward. That's chemistry, not wishful thinking, and it gives us a foundation for the 7-day protocol we're about to build. Before we mix anything, let's set expectations. If your knee pain is caused by a fresh ligament tear or an infection, topical oil is not the answer. You need professional care. But if you're dealing with the wear and tear arthritis that creeps up after 50, if morning stiffness relaxes after a few steps, and if X-rays show mild to moderate joint space narrowing, then reducing inflammation often equals real relief. Clinical trials from rheumatology journals report meaningful pain reduction within 1 to 2 weeks when ginger extract is applied topically twice a day. Olive oil massage has its own dataset pointing to improved range of motion after a week. We're merging those two evidence streams. Let's craft the blend. Choose a small dark glass bottle. Light degrades olive oil phenols. Pour in 3 ounces of high-quality extra virgin olive oil. Grate 1 tablespoon of fresh ginger, juice it through cheesecloth, and add the liquid directly to the oil. Drop in a pinch of sea salt to act as a natural preservative. Then swirl, not shake, for 30 seconds. The mixture turns a gentle amber, develops a warm aroma, and is ready. Application matters more than recipe. Warm the knee first. You can use a moist heating pad or a towel run under hot water and wrung out. 5 minutes of warmth opens superficial blood vessels so the oil travels deeper. After warming, drizzle a half teaspoon into your palm. Rub hands together and work the blend around the kneecap, down the sides toward the tibial plateau, and into the back of the joint where synovial folds hide. Massage slowly for 3 minutes. Let the final minute focus on small circles over tender spots. When you finish, cover the knee with a breathable cotton sleeve to prevent dripping and to keep the joint cozy. Day 1 is about learning the routine. Day 2 introduces consistency. On day 3, we add night application because nighttime swelling sabotages morning comfort. Use half the daytime dose, massage briefly, and slide on a light knee sleeve for sleep. By day 4, you'll notice the skin around the knee feels supple. That's olive oil lipids nourishing epidermis. Day 5 often brings the first measurable shift in the pain scale. Keep a simple log rate discomfort from 1 to 10 each morning before getting out of bed, and each night before applying the oil. That data proves whether you're improving or need adjustments. Day 6 focuses on walking form. Short strides, upright posture, glutes engaged, because joint alignment preserves gains. Day 7 is reassessment day. Compare your pain scores, check swelling around the patellar edges, and test an activity that used to trigger discomfort, such as climbing a single flight of stairs. If pain has dropped even 2 points, you've earned momentum. Keep going another week to reinforce the benefit. Safety checkpoints are built in. If skin reddens or burns, dilute the mixture with more olive oil and shorten the massage time. If your knee swells suddenly or locks, stop and get evaluated. Natural doesn't mean ignore red flags. People on blood-thinning medication should be aware that ginger taken by mouth can potentiate those drugs. But topical use at this dosage has not shown systemic effects in studies. Still, monitor for bruising. Olive oil is generally safe, but very rarely. Folks with severe olive pollen allergies react to topical oil. Patch test on the forearm first. Now, some common questions tend to flood the comment section, so let's address them before they pop up. Can you substitute powdered ginger? Fresh root contains higher gingerol concentration. Powder loses volatile oils during drying, so the results drop. What about adding cayenne or turmeric? Both have merit, but we're aiming for minimal irritation. Cayenne can cause a burning sensation that dissuades seniors from daily use. Turmeric stains clothing. Start simple, master the process, and only then, experiment. Can you ingest the blend? You could drizzle it on salad, but the dose needed for systemic relief is higher than the topical root provides, and the taste is intense. Focus on the skin. Let's zoom out for a moment because a knee never lives alone. Hip mobility, ankle flexibility, and core strength. Each one influences how load travels through the joint. Pair the oil routine with daily hip bridges on the floor, calf stretches against a wall, and brief standing balance, drills, while brushing your teeth. These tiny habits take less than 5 minutes yet shift mechanical stress away from the knee. Pain relief sticks when tissue chemistry and joint mechanics improve together. Nutrition nudges results, too. Olive oil in the massage is wonderful, but adding 2 tablespoons of the same oil to meals amplifies anti-inflammatory action from the inside. Combine it with mixed-color vegetables, wild fish twice a week, and plenty of water to keep cartilage hydrated. Cut back on refined sugar. High glucose spikes inflammatory markers that cancel progress. Sleep is an unsung hero. Overnight, cartilage absorbs nutrients like a sponge. 7 hours or more gives the knee a chance to rebuild microscopic damage. Elevate legs slightly on a pillow, keep the bedroom cool, and silence notifications. Simple changes with big payoff. You may wonder how this approach compares with popular topical gels. Many gels rely on menthol to distract nerves but fade after a few minutes. Our blend targets the inflammatory cascade itself. Prescription creams containing NSAIDs can be effective, yet they carry the risk of skin irritation and require medical monitoring for long-term use. Olive oil and ginger give a milder, sustainable option you can control at home. Let's rehook now with a quick reality check. You started this video because 7 days sounds fast. Does every senior hit that mark? Studies say most notice improvement within 10 to 14 days. The 7-day claim is achievable for many but not all. The key is faithfulness. Twice daily applications. Gentle movement. Proper rest. Missed sessions delay the timeline, but they don't ruin potential. Just resume. Some viewers will ask about bilateral knee pain. Treat each knee separately. Don't skimp on oil. For those with artificial joints, the blend is safe on skin but won't penetrate prosthetic material, so pain related to surgical hardware may persist. Discuss chronic soreness with your surgeon. Mindset matters. Pain often triggers fear of movement, which stiffens joints further. Use the massage ritual as a mindful pause. Feel texture, warmth, and breath. Visualize fluid flowing through cartilage. That calm signals the nervous system to lower threat perception, amplifying relief. Let's circle back to evidence. A randomized controlled trial published in a geriatric journal applied ginger oil twice daily for 1 week to participants over 60 with moderate osteoarthritis. Average pain scores fell by 30%, range of motion improved by 20 degrees, and no severe adverse events occurred. Another study on extra virgin olive oil massage showed significant reductions in knee circumference, a proxy for swelling, within 8 days. These aren't miracle numbers, but they're meaningful. Less pain means more walks, better mood, deeper sleep, and a virtuous cycle of health. What if your hands struggle with the massage? Enlist a partner or use a simple silicone massage cup. Glide it along with light suction to spare wrist joints. Always maintain contact with the skin. Abrupt lifting can leave hickey. Let's spend a moment on the blend's shelf life. Because fresh ginger juice contains water, microbial growth is possible. Store the bottle in the refrigerator, shake gently before use, and discard if the smell turns sour. Make a new batch every 7 days, conveniently aligning with our first reassessment. Some seniors worry about stains on clothing. After the massage, wipe excess oil with a paper towel, wait 5 minutes, then dress. If a sleeve absorbs oil, wash with warm water and a drop of dish detergent before regular laundry. Let's address advanced troubleshooting because not every knee behaves predictably. If pain drifts from the front to the inside of the joint, tight adductor muscles may be involved. Add gentle inner thigh stretches after a massage. If pain sharpens on downhill walks, work on eccentric quadriceps control. Practice slow step-downs from a 6-inch platform. If mornings remain stiff despite evening application, increase nighttime dose to 3/4 teaspoon and extend morning warm-up to 10 minutes. Now, I promised a full daily schedule, so here's how it flows. Narrated so you can picture each step without glancing at notes. Wake up, sit at the edge of the bed, and rate your pain. Place a heating pad on the knee for 5 minutes while sipping water. Remove heat. Apply oil. Massage for 3 minutes. Perform 5 seated knee extensions and 10 heel slides. Continue with a normal breakfast. Mid-morning, stand every hour. March in place for 60 seconds. After lunch, walk for 10 minutes at a comfortable pace. Late afternoon, if swelling rises, cool the knee with a gel pack wrapped in a cloth for 10 minutes. Evening, repeat the warm compress, apply a smaller amount of oil, massage gently, don a light sleeve, elevate legs on the couch while reading. Lights out before 11. Repeat for 7 days. Logging pain scores and observations. As the week progresses, pay attention to wins. No matter how small, climbing steps with less hesitation, rising from a chair without pushing on armrests, sleeping through the night without throbs. Acknowledge these milestones. Motivation fuels consistency. If you reach day 7 with little change, don't abandon ship. Verify that your oil is high-quality. Rancid olive oil lacks active phenols. Check ginger freshness. A shriveled root loses potency. Review technique. Massage motions too light or brief may limit penetration. Adjust and give the routine another week before deciding. Beyond pain relief, this ritual reconnects you with your body. Seniors often feel their joints are betraying them. Nurturing the knee flips that narrative. Touch, warmth, movement. Each one tells your nervous system that the joint is safe, valuable, worthy of care. We're nearing the home stretch of our session, and by now, you have everything required to begin tonight. You know the science, the recipe, the step-by-step application, the movement adjuncts, monitoring strategies, and troubleshooting pathways. You understand realistic timelines, safety considerations, and when to seek medical help. Most importantly, you understand that forward motion is possible at any age, and sometimes it starts with the simplest ingredients. If you found value here, let me know in the chat how your first application feels. And share this stream with a fellow senior who keeps a bottle of olive oil on the counter but never dreamed it could ease their needs.